infection. Okay. The bacterial infection about 5 lecture، يعني 5 محاضرات، ان شاء الله نكملهم خلال نهاية السنة. اوكي. من الليدر تسمعني؟
نعم دكتور.
اوكي. Bacterial infection, we start by Staphylococcal infection. Staph infection, Staphylococci as gram-positive cocci in the family of Mycobacteriaceae form a grape cluster in the gram stain. Are usually found in the colonies of the anterior nares on the skin. يعني هذه البكتيريا هي gram positive in gram stain. لما نسوي لها under microscopy نشوفها gram stain. Commonly found in the nose, in the anterior nares on the skin. Commonly in the skin موجودة بالأكزيلا، موجودة بالinguinal fold, underlying the breast, or commonly infected the immune compromised patient, diabetic, patient taking cytotoxic, any depressed immunity lead to commensal of this bacteria in the skin in the nose. فهي أكثرها تكون non pathological، نسميها colonization، يعني colonization موجودة بدون disease. Okay, traditionally Staphylococcus are divided in 2 groups according to the ability of producing coagulase enzyme. طبعا احنا نميز الستافيلوكوكس from other bacteria by، حتى نميز الستافيلوكوكس من other bacteria by catalase enzyme. الكاتاليز انزيم موجود بكل الستاف، بس هاي الستاف كلها عندها انزيم كاتاليز، لكن هاي الستافيلوكوكاي ممكن نقسمها in 2 group according to the other enzyme اللي هو coagulase enzyme. either coagulase positive or coagulase negative. coagulase positive بكتيريا هي الستافيلوكوكس اوريوس وستافيلوكوكس انترميدياس. بس اللي ما عندهم انزيم اللي هي coagulase negative ستاف نسميها ستافيلو ابيديرميتس، ستافيلوكوكس سبايروفيتيكاس، او ستافيلوكوكس لوجنسس، او ستافيلوكوكس هيموليتيكاس. These bacteria, some of them are common cause of infection, skin infection, boils, carbuncle، وراح نذكر الديزيز اللي causes by this bacteria. Other rare occur in the immune compromised patient, diabetic patient, patient taking cytotoxic, and so on. Epidemiologically, the colonization, what the patient and what the site of the patient that the bacteria preferable to be colonized. Staphylococcal are skin commensal. About 20% of the adults are presently colonized by the Staph aureus. 60% are intermittently colonized, and 20% are never colonized. يعني احنا لما نسوي survey all population نلقى تقريبا 20% من الادلت population there is commensal موجوده colonization، نلقى البكتيريا موجوده. 60% of them of this patient may be present, may be not, intermittently. Other never colonized 20%، فهي more endemic in the population. About لو نجمع 60 و20 فتطلع تقريبا 80% of the population are present of this have this bacteria. The high risk group for Staph aureus colonization include infant، وين نلقاهم اكثر بالانفانت، diabetes mellitus, IV drug abuser, HIV patient, and renal dialysis patient. The methicillin resistant Staph aureus. Okay. Methicillin resistant Staph aureus. This type of this staph resistance to the common use antibiotic. هنا فد مشكلة راح تصير لأنه يراد لها specific type of drug to be eradicate. So methicillin resistant staph risk factor for this colonization include among the hospitalization patient include use of antibiotic, or those do surgery, أو nursing home resident, those high risk for colonization of methicillin-resistant Staph aureus. Frequently exposure to the colonies in this patient. However, this type of bacteria is no longer only in hospitalized patients, but now present in the community. بنسميها community acquired methicillin resistance staph. قبل كانت موجودة بس بالمستشفيات، بس بالنيرسينج كير. هسه لا، حتى ممكن نلقاها موجودة in the community، فهاي مشكلة. الميثيلين resistance staph is important and morbid bacteria to the patient. A clinical feature of Staph aureus. Staph aureus infection clinically divided into the following syndrome. شلون تجي Staph aureus disease? Firstly, either illness due to release of toxin, or illness due to tissue destruction and tissue invasion or abscess formation, or due to hematological separate of this microorganism. Firstly, when produce the toxin leading to the disease at the site of the remote from the site of infection. يعني تسوي clinical sign and symptom away from the site of, for example, Staphylococcal skin syndrome due to release of epidermatological toxin leading to the bully and dissemination of skin. Other example, food-borne illness due to formation of toxin when the ingested food infected with Staph aureus lead to formation of toxin inside the intestine and the release of toxin to the other system and the body lead to sign and symptom of the food-borne illness. Second example هو toxic shock syndrome. التوكسيك shock syndrome هو in toxin produced lead to multisystemic illness affected the liver, renal, and respiratory, commonly occur in the female use tampon. The tampon, intravaginal tampon, commonly affected or unrelated. The other type of syndrome اللي هو illness due to local tissue destruction and abscess formation اللي هي commonly احنا نشوفها بالسكين. In the children example, impetigo, folliculitis, cellulitis, furuncle, carbuncle, mastitis, biomyositis, septic bursitis, septic erythritis, osteomyelitis, epidural abscess, pneumonia, urinary tract infection. So a lot of the disease caused by Staph aureus. How due to hematological infection leading to the separate formation of bacteremia and septicemia lead to infected of blood and lead to multisystemic disease and the patient complain from fever and hypotension, even septic shock. هذه كلها استعراض disease caused by Staph aureus. How to diagnose the patient with Staph aureus disease? The diagnosis relay in the characteristic clinical and epidemiological feature supported by the positive culture from the relevant clinical site with identification when appropriate, with toxin identification of toxin. يعني نعتمد على clinical picture of the disease. هل تجيك boil, pneumonia, UTI, and then supported by seeing the sample for culture. فتطلع لنا gram positive culturing indicate the presence of this infection. أو detection of the toxin produced by this bacteria. هذا supported the diagnosis. Now recently use bacterial genome sequencing اللي هي polymerase chain reaction PCR now اللي هو more specific on 100% diagnostic, more precise aureus graph coagulase negative and coagulase positive. الكوagulase negative اذا لقينا coagulase negative اللي هي معناتها يعني coagulase زايد هاي commonly treated by vancomycin. ليش treat by vancomycin؟ لانه الفانكومايسين هو السلاح الاخير للستاف. بما ان الكوagulase negative staff اللي هي commonly methicillin resistant staff treatment by vancomycin is a ministry of the treatment. vancomycin injection or vancomycin tap. Staph aureus antimicrobial choice should be based on the local prevalence of methicillin resistance and the clinicality of the illness. A bactericidal agent, preferably either beta-lactam, is used whenever possible. إذا لقينا هي B-lactamase positive فإحنا treated by the beta-lactam antibiotic. If resistance نحاول نسوي methicillin like drugs. If resistance to the common agent that used against methicillin resistant staph اللي هي clindamycin, trimethylphenylsulfa methoxazole, doxycycline, minocycline أو lisinozyde commonly used. Lastly, use a glycoprotein اللي هي vancomycin and ticoblonine. These drugs commonly used for methicillin resistance staph. Okay. The disease commonly caused by Staph aureus called Staphylococcus scalded skin syndrome. This disease is Staphylococcus epidermal necrolysis cause spectrum of superficial blasting skin disorder caused by the toxin formation by staph. This syndrome of acute exavulation of skin typically followed by the erythematous cystitis. يعني يبدي by exavulation أول مرة by erythema of the skin, then exfoliation of the skin, and then all symptoms of this disease. Severity of Staphylococcus scalded skin syndrome vary from a few blisters localized at the site of infection to more severe affect all of the body. The mild form of this illness involves the dissemination of skin at the site of infection. Example, impetigo. When linked to the impetigo lesion, we see dissemination around the lesion. هذا نسميه scalded skin disease. Commonly treated by fluoxetine. A treatment involves topical or systemic antibiotic for infection site and supportive care for skin and soft tissue destruction. بالإضافة إلى support treatment, antibiotic use, the most commonly antibiotic use اللي هي fluoxetine. Other type of drug أو السندروم اللي هو عفوا foodborne illness due to preformed toxin. The Staph aureus can produce heat-stable super-antigen toxin that can persist in the after cooking or foodborne due to preformed toxin. The suffers produce heat-stable super-antigen can be persist even after cooking, as eradicate that organism. The ingestion of the toxin is contaminated by the food, lead to multiplication of this microorganism inside the intestine and produce this toxin. This syndrome is a short incubation period after 2 to 6 hours, followed by sudden vomiting, diarrhea, and occasionally fever. So the patient present to you after food poisoning contaminated by staph lead to sign and symptom rapid onset of fever, diarrhea, vomiting after ingestion of the infectious food due to production of this toxin from this bacteria. After the diagnosis of this patient clinically and supported by the gram stain, the treatment involves supportive care, rehydration, IV fluid taking, and then a treatment by suitable anti-staph treatment. And the patient improve gradually and self-limiting disease within 12 hours. اللي هي commonly اللي present to you with a food poisoning. Other syndrome called Staphylococcal toxic shock syndrome. This a serious and life-threatening disease is associated with infection by Staph aureus that produce toxin. This toxin called toxin shock syndrome type 1. It was commonly seen in the young women associated with use of highly absorbable intravaginal tampon, but can occur even without use of this material. Result from inside to produce of the toxin inside the body. This toxin separate in the blood lead to super antigen and triggering of the significantly helper cell activation, lead to multisystemic involvement, affected the liver, renal, respiratory. So the clinical picture of this syndrome characterized by the following. Has abrupt onset with high-grade fever and generalized systemic upset, like myalgia, headache, sore throat, and vomiting, then followed by generalized erythematous blistering rash resembling that occur in the scalp fever, and then develop hypotension. It is rapidly progress over the matter of the hour and multisystemic disease involvement and lead to cardiac and renal and liver decompromise and the death highly mortality about 10 to 20%. After recovery within 10 to 8 days and with dissemination of skin. How to diagnose of this syndrome? The diagnosis clinically may be confirmed by ministerial case by vaginal examination of the lady, the finding of the retained tampon, and microbiological examination of this tampon for gram stain, the gram stain identified as the Staph aureus cocci, supported by culturing and demonstrate of toxin produce may be confirmed the diagnosis. يعني either seen the tampon for gram stain حتى نشوف الستاف aureus أو culturing of the Staph aureus and then demonstration of the toxin produced by this bacteria. How to manage of this patient? The treatment is by immediate and supportive fluid resuscitation and IV anti-staph use. Common use anti-staph هي flucloxacillin or vancomycin, usually with addition of the protein synthesis inhibitor اللي هي نقلل البروتين synthesis in this bacteria. Example use clindamycin. So clindamycin to inhibit the synthesis of the bacteria, to inhibit the toxin produced by bacteria. Sometimes use IV immunoglobulin is commonly added in this most serious case. Women who recover after healing and recover from this disease should be aware that not use tampon 1 year later because the recurrence of this syndrome. So the treatment of this syndrome by support treatment, use of antibiotic, use of the protein synthesis inhibitor اللي هي clindamycin, and IV immunoglobulin can be used. This diagram shows the selection of the antibiotic for Staph aureus infection. The selection of the antibiotic for Staph by the following according to the sensitivity to the drug. So as you know, about only less than 5% of the Staphylococcal are sensitive to penicillin, and about 95 to the 90% of the Staph are resistant to penicillin group. Why resistant to penicillin group? Because formation of the beta-lactamase enzyme that destructed of this antibiotic. احنا لما نسوي sensitivity ولقينا 5% sensitive to penicillin treated by penicillin اللي هو penicillin G. If resistance to the penicillin واللي هي الcommon المور percentage are resistance راح نحاول نشوفها هل هي sensitive or resistant to methicillin group. لقوا انه تقريبا more than 50% of the staff are resistant to methicillin and less than 50 are methicillin sensitive. الميثيسيلين sensitive treatment by methicillin like group اللي هي اوكساسيلين، فلوكساسيلين، نامفيسيلين، then نسميهم ميثيسيلين sensitive drug. If resistance to methicillin treatment by vancomycin, tocoplanine, cyclodoxin and so on. سلفاميثوكسازول او اللي ذكرناها كليندومايسين او treated by erythromycin and so on. بس المين drug used for methicillin resistance drug اللي هو الفانكومايسين and tocoplanine. Therapy for toxic shock syndrome. The common antibiotic used according to this table. If the penicillin sensitive, use penicillin or ampicillin or ampicillin with sulbactam according to this dose. But if the penicillin إذا penicillin sensitive، إذا penicillin sensitive but penicillin resistant نستخدم الأوكساسيلين أو سيفيزولين. If the methicillin resistance هنا المشكلة نستخدم شنو؟ antibiotic اللي هي vancomycin, clindamycin, doxycycline, tocoplanine, lisinozyde and so on. Or quinolone group اللي هي ciprofloxacin, norfloxacin and so on. بالإضافة use immunoglobulin in this disease. هذا التيبل يخليك إنه يا درج تختارها للستاف إذا كانت هي penicillin sensitive أو methicillin resistant sensitive أو methicillin resistance accordingly. A clinical syndrome caused by coagulase negative staph. كل الحكي اللي حكيناه هي coagulase positive staph اللي هي staph aureus. But how to deal with coagulase negative staph? The coagulase negative Staphylococca are generally less virulent than the staph aureus. Most infections with this organism are the consequence of multiple progress, are the medical progress related to the foreign body use that are associated with healthcare. يعني شنو هي دائما infected of the any instrument that use in the body orthopedic, knee transplantation, or any stent use, or any foreign body put in the body lead to infected by this organism. Example, endocarditis commonly infected the prosthetic valve or native valve, or other cause who are intravascular catheter use, like the CV line in the dialysis or use cannula use lead to infected. Or prosthetic joint infection. Up to 38% of orthoplasty infection caused by coagulase negative staph. Peritoneal dialysis catheter or post-ocular infection in the eye surgery commonly caused by this bacteria. Other group of bacteria اللي يسميها streptococcal infection. The streptococcal infection are nasopharyngeal and gut commensal. Commonly هذا other group احنا هسه الستاف كملناها. الother group هي streptococcal infection commonly found in the nasopharyngeal, in the nose, in the pharynx, and in the gut, in the GIT. Will appear as a gram-positive cocci in chain. يعني تجي على شكل chain gram-positive. They are classified by the hemolysis they produce by blood agar. فنقسم اما beta hemolytic streptococci from A, B, C, and G, or alpha hemolytic streptococci هي streptococcal pneumonia, streptococcal viridans, or enterococci commonly present in the GIT نسميها enterococci fecalis, enterococci faecilam. The common disease caused by streptococcal A infection, skin and soft tissue infection, include erysipelas, impetigo, necrotic fasciitis, or also cause streptococcal toxic shock syndrome. التوكسيك شوك سندروم ما يصير بس الستاف، لا ممكن يصير باي ستريبتوكوكاي. Berberal sepsis after delivery, berberal sepsis, scarlet fever, glomerulonephritis, rheumatic fever, bone and joint infection, and tonsillitis. Streptococcal toxic shock syndrome is associated with severe group A infection, commonly group C and G infection. Streptococcal skin infection produce one of the variety of toxins such as biogenic toxin A. Like Staphylococcal toxic shock syndrome, مثل ما ذكرنا سابقا, they act as a super antigen that the stimulation of the T helper cell and lead to dramatic cytokine response and lead to all signs and symptoms of the syndrome. Initially, influenza-like infection occur. A clinical shown EEG هذا patient occur with 50% of the case sign of the localized infection. Most often involve the skin and skin tissue and the soft tissue. A faint erythematous rash mainly in the chest and rapidly progress to involve a circulating decompromise, lead to shock state. Without aggressive management, lead to multi-systemic and multi-organ failure and high mortality. How to treatment of streptococcal toxic shock syndrome by يعني fluid resuscitation and antibiotic ثاني بنسلين اللي هو بنزايل بنسلين IV injection and protein inhibitor like clindamycin to inhibit toxin produce. نفس التريتمنت of Staphylococcal toxic shock syndrome. IV immunoglobulin is usually administered to localized care with necrotizing fasciitis or infection or sort of infection should be treated. Scalded fever. Scalded fever is caused by group A streptococcal produced by erythematous toxin. In addition, as in the individual who not possess neutralizing antitoxin previously. The clinical feature of scalded fever. The clinical features is a mild disease which mainly affect the children. An incubation period 2 to 4 days followed by streptococcal infection, usually infected by pharynx and regional lymphadenopathy, fever, rigor, headache, and vomiting are present. The rash with a plunge in the pressure. يعني وين نسوي plunging to the skin lead to blanching. Usually appear in the second day of the illness. It initially occur in the neck, but rapidly progress to paniculated and erythematous and generalized skin rash. It is typically absent from the face and palm muscle. يعني هذا السكن راش ما موجود بالفيس وما موجود بالبالم ولا بالصوت. هذه الفيتشر support your diagnosis. It is prominent in the flexor part of the skin. Usually, the rash usually lasts for 5 days and it's followed by dissemination of the skin. The face is flushing and the characteristic circo-oral pallor. يعني يصير الفيس are flush. Around the oral there is a pale high feature of this scalded fever. The patient is infected for 10 to 21 days after the onset of the rash. Unless the treatment with penicillin, the scalded fever may be complicated by the post-tonsillar or retropharyngeal abscess formation and otitis media. إذا إحنا ما نعالج هذه by suitable antibiotic, الcomplication هي pretonsillar abscess, retropharyngeal abscess, and otitis media may be complicated. The diagnosis is established by topical clinical feature, يعني typical clinical feature, and culture of the throat swab, elevation of SOI titer and anti-DNase B level increasing in the serum. This indicated there is a streptococcal infection. Then by culture or by elevated of anti-streptococcal or antigen or anti-DNA B level increase in the blood that indication there is infection. The treatment of choice, the penicillin is a drug of choice and is given orally as phenoxybenzyl penicillin 500 milligram 4 times daily for 10 days. Individual allergic to the penicillin can be treated by the erythromycin 250 milligram 4 times daily for 10 days. The treatment is usually effective in the preventing of rheumatic fever and acute glomerulonephritis. طبعا احنا اذا not treated of this infection lead to cross lesion to the kidney, lesion to the heart, نسوي rheumatic fever. طبعا effective endocarditis هي inflammation of the heart valve due to the infection او تؤدينا infected the kidney اللي هي glomerulonephritis if not treated of this infection. So should the treatment of this syndrome potentially, which are non-supportive complication of streptococcal pharyngitis. Unlike acute traumatic fever, the streptococcal nephritis may also complicate the streptococcal skin infection. زين؟ الGN ممكن تجي من السكين infection or throat infection. بس الروماتيك فيبر لا تجي بس pharyngitis, not complicated skin infection. This picture اللي هي typical streptococcal scalded skin syndrome. نشوف هنا السكين are disseminated with erythema skin rash. This impetigo caused by Staphylococcus aureus. This picture scalded fever. شوف blanching erythematous skin rash. This is cellulitis caused by staph and streptococcal. Both cause cellulitis, a red erythematous skin rash of the lower limb. This necrotizing fasciitis, so infection of skin and deep fascia, commonly caused by Staphylococcus aureus. Thank you.